In today's session, we're going to discuss the following objectives: understanding, defining the why of iterative change, what is the outcome, identifying the outcome, defining the measurement, and evaluating, and then taking back operational tools to your organization via the pre-work. And you can access those readings via the same email that you accessed for accessing this video. So first off, we're going to start off with really what is and why is it important to identify outcomes, define the measurement, and evaluate. Well, we measure, monitor in order to make a difference. At the end of the day, being a part of mental health and substance use disorder prevention, treatment, and recovery, we are bound by incredible amount of evidence-based practice models, regulation and compliance, and simply regulatory impacts of how we do the business that we do. So in order to make that difference, we have to ensure that we have measurements, that we monitor, and we understand the work that we're doing. So when it comes to change, change is just another term for setting a goal. So what are you wanting to achieve? Choosing metrics, how will you know what's working? And then collecting data so that the numbers in your data collection can weave a data story that is both synonymous and amplifies the original activities, operations, and programmatic models of the work that you're doing, and ultimately reporting outcomes. So what worked? How do we replicate that? How do we train that next staff member? How do we operationalize that model? How do we account for creating the next organization to utilize this change to better and improve the work that they're doing? So we look at measuring, monitoring, making a difference. That overall showcases the why of why we have to define our outcomes and understand the evaluative process that we're undertaking. Now, a couple comments on evaluation. So here's the overall foundations of evaluation in two very quick slides. The first one is the context of why do we evaluate. Evaluations will ultimately help you track your activities and progress towards goals, determining if you are actually improving those outcomes, and very importantly, letting stakeholders and funders know the value of your work. So stakeholders and funders, in our case, from those participating in Transformation Change Agency, would not only be your organizational leaders, but the funders that are funding your organization to do work. And then allowing for an opportunity to really visualize that continuous quality improvement, right? Evaluation helps us to really visually differentiate why this is better, and our communication plans help us to distribute the message of, yes, come participate, be a co-producer in these improvements. It also helps us to keep track of time and dollars and activities. In previous sessions, we discussed the impacts of knowing our overall value, but then also understanding the cost structures of how to derive that value. And then ultimately looking at understanding that if data shows that there are additional improvements needed, that we're actionable on those improvements. Dennis, Kelly, other thoughts of additional reasons of why to evaluate?
Well, evaluating showcases your strengths and your weaknesses. And if you're just, if you're everyday bits of business, the number that you're serving, if you're doing a better than okay job. I think one thing that's kind of been interesting when I've looked at evaluation is perhaps a team or a person or a group is doing an exceptional job. They are absolutely outstanding, but we've never been able to replicate that. And looking at how we train, who we use as trainers, and who we still have doing some of the day-to-day work, is kind of key to making that happen too. Sometimes it is just a person's style that makes something fantastic, but there are ways to really elevate the entire organization if we look at where and how we're training as well, to identify like those gaps in service, those areas that we can do just a little bit better, but also understanding, how do we capitalize on something that's really outstanding and build upon it?
There's a really to build upon what Kelly's saying. One of my favorite phrases, and there's a good book on it in conversation. The great Brazilian educator Paulo Freire says, "We make the road by walking." And I think, when you're talking about it's the actual process of evaluation, going back to earlier conversations around towards inclusion, I would argue that the shared process of engaging in evaluation is essential to the work. So in addition to some of these deliverables, the act and the art of having these conversations, although can be daunting, can ultimately be quite healthy to an organization. And anyone who has been in a long-term relationship, or perhaps has children, might understand the essence of what I'm getting at on a personal level, that the work is quite hard, but it's actually having those conversations that can generate a high degree of yield.
Absolutely.
Great comments and feedback. When we look at the inclusive practice of evaluation, that is even more reason to really ensure that these best practice approaches are standardized within our change management, as it not only compels us to search out and seek additional feedback and support, as Dennis and Kelly showcased in their examples, but also allows us to comply with the national class standards, which is another of our key how we do business frameworks within mental health and addictions providers space. And for those that have not had an opportunity to listen to the National Cultural Linguistic Appropriate Services Standards webinar, that is within the Learning Resource Index that can be found at DMHA-CLC-resources.com. As we look at the second
Tony,
slide,
I'd like to also throw out there too that with behavioral health, sometimes if we're looking at perhaps our clientele as a whole, or our approaches to our clientele as a whole, it gets a little tricky if we have someone who is constantly in crisis, or their diagnosis is very varied from our other clientele. And it's really important, as we're measuring and as we're pulling statistics and that sort of thing, that we take some of these special cases and really look at them, and not just remove them from our evaluation, but evaluate them separately, and then look at how well your approach is with that individual, and go ahead and submit that separately, and in addition to the other pieces. And you can learn from that. You can learn by coaxing, by aligning that with everything that's working in the other areas. But behavioral health can be somewhat tricky in this scenario, because we're not able to always measure apples to apples. And so it's important to account for that throughout all of this work.
great points, Kelly. Thank you. Absolutely. And so in our best practices approaches, meaningful as well from the key measures perspective, in looking at really understanding knowing what's working, knowing your impact, and showing your value, but utilizing those key contexts into very specific measurements of, from an effectiveness perspective, have we identified the key performance indicators at the beginning of the change identification definition? Do we know if those key performance indicators are tied to our goals and objectives? And have we showcased exactly how achieving those key performance indicators at the a set out timeline will account for further effectiveness of our identified change towards our organization? Have we accounted for as activities are being defined and trained to, and as we look at overall frequency and sequencing of activities, are they being standardized, and are we measuring the efficiency of our resources in carrying out those activities and in the time calculations? And that could be something as simple as the time to conduct an initial intake, and how that initial intake should be efficient use of both the staff and the patient's time to account for getting to that next step of effectiveness, and how maybe we need to, in order to account for efficiency and effectiveness, make changes to our intake forms as far as the number of fields, the level of intrusiveness, or direct intimate information that we're asking patients on a very first interaction. And as we further look at key measures, do we understand the time and the cost of that time and the other production costs of materials, training attendance, the efficiency ramp up, and how does that cost effectiveness overall account for being able to do more, not necessarily with less, but with what you have? And then as we continue to impact effectiveness, efficiency, and cost effectiveness overall, having an understanding of attribution where it's really defined as who and what portion of the process is best applied to support the progress on goals and objectives, but also our standardized work. So these best practice approaches on how we should be able to measure our change on every change management opportunity is effectiveness, efficiency, cost effectiveness, and attribution. And then looking at really creating a culture that embraces evaluation. Kelly, any additional thoughts regarding best practice approaches or kind of in field or in practice applications that you'd like to address?
No, I think you did an excellent job of going over what we need to do. I think sometimes people, when they look at cost effectiveness, forget to look a little further into what they're trying to accomplish and what bits of it they can at least start or do that doesn't cost anything. And I think sometimes we start to see additional efficiencies when we start saying, oh, look how creative we were, and this didn't cost us. It might have even saved us some money, or it made a more content workplace or something, because we did these kind of niceties, but they didn't cost us anything. And sometimes I think it's worth looking at that once a quarter, once every 6 months, once a year, just to improve some practices and not be scared that, oh, to do that it will cost a lot of money. Well, what can it do that doesn't cost?
Can I add on to that really briefly, Kelly? I think you really you're making some extremely sound points. It is in many ways almost unfair to ask an organization that is perhaps under-resourced, or even if you are resourced, but being emotionally taxing, time intensively taxed, to be able to do even consider, much less implement, long-range planning. And sometimes when we are concerned about and often have to justify budgets to folks that may not understand the particulars or what it actually takes to have your organization survive, much less thrive. So it can be, it's almost an unfair ask to consider the forest and not just the trees. That said, most of this work requires to be done effectively and done well. You can actually, by taking the long view, actually save your organization money. You can save your organization time. You can save your organization the wherewithal, frankly, and the fortitude of your employees, because if you're going to do anything that's going to say along the lines of professional development, right, for example, when it's brought out in a piecemeal approach and there's not an understanding of the larger long-term strategic plan, you've lost opportunities to have your employees have a sense of buy-in, right, and commitment to the organization. And then there's also this sense, well, this is just another workshop. This is really being done more to sort of protect us legally or what have you, and it's really not aligned with anything. So even my attendance, participation, engagement, and learning from a particular professional development experience is not going to be the same as if I can clearly identify how this aligns with my organization's long-term values, mission, and mission. So in addition to being able, when you're planning out things, with a 3-year plan or a 5-year plan, you can tend to have things more cost effective, right?
To account for outcome measurements and evaluation towards looking at iterative change and continuing to identify and celebrate the value of that change. In a quick 6 steps. So what is change versus activity versus program versus outcome, et cetera, et cetera. Well, here's to simplify that in our steps to take. When you first identify the change you are trying to make, that is beginning with the end in mind. And beginning with the end in mind showcases that you've thought through the visualization of what it is where you are today, what is current, what is standard, and you visualize what you would like for the future to look like. That is your outcome. And then ultimately your steps along the way and the goals that you've defined is how you will get there. When you begin that work, then looking at those steps, tracking those, here's some helpful questions that we should always ask ourselves in the support of change management. Looking at who does the change impact? Do we have demographic information? Do we know enough about our core constituency to begin with? And have we identified the impact to that change overall? What is the current process? What improvements are needed? And what is the new process? What documents, training, et cetera, are needed? Dennis, Kelly, any additional questions you would like to share in consideration of the steps to track the work that we're doing in change management?
I think I would just ask everyone to keep in mind that a lot of us use this phrase a lot when we're working with our patients, that it's, and you know nothing about me without me. And I think we need to do that as well with our frontline folks, with anybody that at any level that we're making a decision. If we haven't included those folks in the process, are we really getting it right? And I think it's just really, a good phrase throughout, nothing about me without me, to make sure that we're including the folks who are doing the work, to understand that yes, this actually is the best way to do this process.
There's nothing that I could add that would be nearly as important as what Kelly Meyer just said. 150%.
Then looking at the step 3, we are looking at how to determine how you will gather the information you need. And this particular piece is then defining your measurement. Once you've defined the sources of data, how you're going to calculate that data, the continuous report mechanisms, etc., then we can move into determine how often you will review that information. This is then your evaluation activity. And to both Kelly and Dennis's earlier points, this is really when you are practicing the behavioral trait of flexibility and openness, and accounting for a desire to see change and improvements be made. And so as you're inclusive of others and participating in your evaluation activity, there really should be no pride of authorship or any real concerns about the, let me rephrase. There shouldn't be any pride of authorship within this review of the information, but really looking at it through a lens of how will this best support our patients? How will this account for inclusion within our workplace? And how will this impact our overall effectiveness, efficiencies in the work that we do? Once you've come together to review the information and account for inclusion in understanding how you arrived at the evaluation details, the sources of data, the measurements, and the overall construct of the activities with that visualization of the outcome at the very end. Because as we all are doing work on a day-to-day, being able to look at documentation at each milestone juncture, outlining the activities, the change requests, the overall measurements, and the improvements that have resulted, and the efficiencies, effectiveness that has resulted, really substantiates not only the process of change management, but it continues to develop your organization as an organization where measurement, evaluation, and overall transparency is at the forefront of your organization's culture. And then last but not least, sharing with the internal team and determining if any improvements are needed, sharing the report then as well, including recommendations for future with that internal team, external stakeholders, and potential funders. And then this ultimately is you championing the change and reiterating the value ongoing of your end visualized outcome and the overall organization's adoption of a change management culture. Dennis, Kelly, reflections on those steps?
I think the biggest consideration that comes to mind now is being mindful of who's on that team. And then again, the demographics of your organizations are going to look different, and in some spaces there may be this speaks in a lot of ways to a point that Kelly beautifully illustrated earlier. Making sure that you're not just doing things for folks without asking what they need, what they want. And so when it's just really a threading the needle opportunity that can really lend itself towards disrupting any growth, any inclusion that you'd like. So making sure that you have a myriad array of voices at the table. And I think even when you're doing that in any change process teams, that to be mindful of the makeup of the group, and certainly before we hit the button, because sometimes we have other emails to respond to and other meetings to attend and other projects to work on and other clients that are overdue, that have been waiting for quite some time. And so sometimes it can feel seductive, for lack of a better word. Let's just, okay, we've got some degree of consensus, let's move on. I think it's always okay to be deliberate, as long as it is not kicking the can, so to speak. As long as it is being more thoughtful about passing the baton as opposed to passing the buck, that you can always ask, are there things that we're missing here, right? What are we missing? What are we leaving out? Who are we leaving out? And so I think to be really intentional about that, and if your organization, if your team has gone through this process and say, no, we're good right now, we're doing our due diligence, I think it will be done with a bit more authenticity and a bit more satisfaction.
I agree with everything Dennis just said.
Well, we end the specific overview on the measure, monitor, and evaluation in looking at our final set of visuals, hailing back to our earlier slide on we measure, monitor to make a difference, and we evaluate to ensure that we're being inclusive of all perspectives regarding that change so that we can continue a culture of change management and practicing accountability and transparency.
I'd really like to thank everyone for taking this deep dive and really giving this very strong consideration. It's great work, it's great stuff, and I know they will benefit tremendously from this great work. So again, thank you.